A unique procedure for reducing facial wrinkles without surgery is the use of injectable fillers. Here to explain all about fillers is Dr. Gene-Rubenstein at the Dermatology and Laser Center in Studio City.
Typically, the changes of aging are that we start to lose volume in our face, so the face looks like it's deflating. There's a loss of elasticity in the face. That loss of elasticity causes wrinkling to form. There's also a tremendous amount of sun damage that happens as we age. So all of these things contribute to the need for fillers. A filler is any substance which is placed into the skin, usually by injection, which stays in the skin for a certain amount of time and then is metabolized usually by the body. And also there are some fillers that are permanent. There are different types of wrinkles. For example, the wrinkles around the nose and the mouth, the nasolabial folds, is one type of wrinkle. Other wrinkles are the fine lines around the eyes. Other wrinkles are the lines on the forehead. So each one requires different treatments. Sometimes the treatment is fillers. In the case of nasolabial folds, it's very effective to put fillers into the area to fill in the nasolabial folds. In the case of bags under the eyes, we can do the same thing. We could also fill in underneath that groove that forms under the eye as we age, and to fill it in and to smooth out the bags under the eyes. The fine lines as well, the fine lines, the smoker lines around the mouth can be filled in with fillers as well. So each area requires a different type of filler, and it really requires a consultation with a doctor to decide what kind of filler is used. I use a variety of fillers for different reasons. For example, I use one called Sculptra, which is put into an area of skin which has lost its volume. Sculptra is a volumizer. It lasts around 2 years in the body, and it's great for reinflating that balloon that has deflated over time. Another filler I use is something called Restylane. Restylane is great for under the eyes, for the bags that form under the eyes, and also for nasolabial folds. Another filler that I use is called Radiesse. Radiesse is put into the nasolabial folds and other folds that are deep, and it lasts up to 2 years. The reason why fillers and other non-invasive techniques that dermatologists typically do are so important today is that people want to delay serious plastic surgery. They want to look as good as they feel inside for as long as possible, and they want to do it naturally. It is instant gratification. We can actually see right during the treatment, we can see as the lines fill in. So it's almost like we're sculpting with the face. We're actually able to put the tissue back in, and we're able to have an incredible result right away.
Wow.
Typically, my patients go back to work very quickly after the procedure. They can't expect some swelling, they can't expect some redness. Oftentimes, they can cover it up very effectively with just superficial makeup or other things. I think it's important to know who's injecting the substance, especially if it's a longer lasting substance. We know that certain fillers have to be put into a certain area of skin, and you have to be a very experienced injector to do that. I would suggest you go to someone who is used to injecting patients, someone who is board certified in a specialty that is used to injecting, such as dermatologist, plastic surgeon, ear, nose, and throat doctor, who knows how to inject. The type of comments that the patients tell me is that other people around them tell them that they look well rested, that they look happier, that they look like, not like they've had anything done, because that's my aim, to keep it looking natural, but they look younger for some reason. Oftentimes patients tell me that people look at them and they can't tell why they look younger, but they just do.